We know that health messaging on tobacco packaging works.
If you're a smoker, you'll start to notice that your cigarettes might look a little bit different in the coming year. In a world first, Canada announced that it would start putting health warnings on individual cigarettes. So, what will that look like, and will it work in getting people to smoke less?
For many smokers, the cigarette is a friend who never complains. But having a health warning on every cigarette is going to have a message every time that smoker smokes.
Poison in every puff. Cigarettes cause impotence. Tobacco smoke harms children. Those are just some of the phrases that will be staring back at you whenever you take a drag from a cigarette.
Many kids who experiment smoking do so by borrowing a cigarette from a friend. They may not see the warning on a package the way they would when they have that health warning directly on every cigarette. This is an additional way and an effective way to convey the health effects of smoking.
The announcement came on World No Tobacco Day, and warnings on individual cigarettes, that was just one part of it. So most of us have seen these labels, right, that are on cigarette packages right now. Well, those will be updated with new health warnings on a rotation. So you'll see different ones at different times, and the government could update them to reflect the latest research in science, for example. There will also be health information on the upper flap of the package, like, on the benefits of quitting, for example. And all of these measures take effect August 1st, with manufacturers and retailers having somewhere between 6 months to more than 3 years to implement them. Now, we've heard over and over that warning labels, well, they work.
Pictorial warnings, large pictorial warnings, increase the awareness for smokers and those who do not smoke of the harms, the extraordinary harms of cigarettes. We also know it motivates people to quit, and it also hinders youth from starting. So there is a lot of evidence.
The rate of Canadians who smoke cigarettes has declined over time.
We have a lot more that remains to be done. There are still 3.8 million Canadians who smoke. There are still 46,000 deaths each year from tobacco use. We need a comprehensive strategy, not just one thing, and this regulation is one part of a larger mix.
Sure, this latest announcement is part of Canada's tobacco strategy, which aims to have less than 5% tobacco use by 2035.
Today's announcement on increasing, changing, revising the warning labels, including warnings directly on cigarettes themselves, is a step in that direction. But I think for us to achieve that goal, we need to go further and deeper.
The further and deeper bit, that's an interesting part of all of this too, because some advocates are saying Canada should be doing more and looking to a country like New Zealand, which is taking some drastic steps to curb cigarette use, including passing a bill last year that bans the sale of tobacco to anyone born on or after January 1st, 2009, effectively making tobacco products unavailable for future generations.
This bill will create generational change, and it'll leave a legacy of better health for our youth.
And there's more.
In addition to, increasing the age of legal purchase 1 year at a time, which is really slow, but I think that's an important step. But it won't be realized, the effects won't be realized for many years from now. What they're doing in 2025 is to require that all cigarettes have a limit of nicotine at minimally or non-addictive levels.
And that's kind of huge because nicotine is what makes cigarettes addictive.
They smoke for the nicotine, but they die from the tar. So if you remove or reduce the nicotine to non-addictive levels, then the appeal of cigarettes will go down. And it's something that perhaps, the Canadian government should be considering, because it would be a regulation on the product itself that would significantly reduce its attractiveness.
Now, is that a step that Canada would actually take? Well, only the government can answer that. But for now, expect those warnings to be front and center, even more so than they already are. Let's head back to the studio. Now, I'm so happy to have health and science reporter Christine Birak joining us right now, because you've been working a lot on this story. And can you remind us, like, just sort of to set the table, why the urgency? Like why would the government go out on a limb and change the rules in such a way to really try to clamp down on the number of smokers out there?
You know, I think most people know that smoking is bad, but over the course of, smoking being in the population, we've lost sight of how bad it really is. And the sheer amount of death and disease that smoking has brought on the population. And just to put it in perspective for you, you mentioned in the intro that 50,000 Canadians die every year from smoking-related illnesses. About 50,000 Canadians have died from COVID-19 over the course of the pandemic so far.
Yeah.
So experts will tell you that there has been a pandemic of smoking for the last 50 years. It has killed hundreds of millions of people. It is costing billions of dollars to the economy and in healthcare systems. It is one of the world's largest health problems, and it's completely preventable.
Yeah, that's interesting that you say that. Like the numbers are astronomical, right? Like we all know that, and yet we've just become, I guess, numb to the problem.
Yeah, and I'll say even for myself, initially when I had heard about more labels, I thought to myself, well, there are already labels on these packages. How much of a difference is more labeling going to make? We went out, we talked to smokers, we asked them. Some of them were like, yeah, I mean, almost every smoker you talk to wants to quit. Some of them would say, yeah, this might help. Others were like, yeah, I'll see it, but then I will stop noticing at some point, much like I have the containers. But when we talked to experts and they showed us the studies, they said, you know what, labeling is effective. It is an education. Right now, 20 billion cigarettes are being sold every year in this country. And if there is actually a label on each one of those, it is almost like it's marketing for how bad this product is that you are about to put into your mouth.
And I'm just, the visual is striking, right? When you see like just a stark white cigarette with black letters that say every puff is poison, right? Or smoking causes impotence, and you're putting this thing in your mouth, and people are like...
It doesn't get more in your face.
Sure, yeah, no, of course.
Than that.
So did you get any sense in your reporting, Christine, that the federal government is looking to do even more than this, right? Like we mentioned the sort of grand tobacco strategy that the government has. Like what more do they plan to do?
Yeah, well, they do hope that the labels will make a difference and push. And I will bring up, especially for kids, the labels matter, because sometimes we think everybody knows the health harms. Kids don't. And when they're getting cigarettes from people and the addiction is building, they're not seeing those messages on the package.
Yeah, you don't get the carton.
Exactly. So this is helpful to stop young people from starting as well. But yes, there's a lot more that needs to be done. We know, you mentioned New Zealand, all of the measures that they are taking, they're trying to get to 5% tobacco use by 2025, which is just in a couple of years. So here in Canada, there's a lot of lessons that still can be learned. Some of them are old lessons that they need to double down on. One is raising taxes. We know that making something cost prohibitive, people buy it less. So raising the taxes on them. Also limiting where they are seen and where they are sold. When they become inaccessible, people tend to buy something less. And the other really big one, and this is beyond the marketing, and this is the hold that tobacco companies have on people, is the nicotine levels. People become addicted to the nicotine. It happens quickly and it happens deeply. So those nicotine levels need to come down. And the last thing is really supporting current smokers. In Ontario, there's a program, and I just found this out yesterday, that is offering individual counseling and group support, and they're having 400 people a day sign up to get into these programs. So people do want to quit. The consequences are really high, and more does need to be done.
What are the numbers, by the way, in terms of like how many people in Canada do currently smoke? Like you mentioned New Zealand trying to get down to that 5% target rate, right? Like is Canada close? Or
Canada is at, so I'll tell you, it's been declining significantly. Sure. Like in 9 years ago, the rate was almost 20%. So it's been coming down for decades as a result of education. Now we're down to about 12 or 13%, 12% smoking, 13% tobacco use. And those numbers need to come down even further. So there is this sense that to get there, there has to be a robust a strategy. New Zealand is taking this very seriously. So there is a sense that that more needs to be done, that we need to be able to help adult smokers. We need to be, the youth smoking rates have been coming down. And that's what's interesting. We haven't seen a lot of adult smokers quit. It really has been 50 years of education that has stopped young people from starting. And that's what's really been bringing smoking rates down.
But can I ask you this, and maybe at the risk of pulling us a little bit off track, but with smoking rates going down, I feel like vaping rates have been going up, right? Like, is there any part of this strategy that applies or would be directed in that direction, or do we think that's just a completely separate issue?
So experts have told me that vaping or e-cigarettes can help some adult smokers quit.
Right.
So far, it has not been going as planned. So the messaging has really gone a little bit askew, and the regulations have not kept up with the products that tobacco companies are putting out there. So what we're seeing in terms of vaping is these fun packages, these fun flavors.
Yeah.
It almost sounds like the beginning of smoking all over again.
That's right.
And as a result, we've seen teen vaping rates are now hitting about 15% of Canadian teens have vaped in the past month. These products were meant for, or apparently meant for smokers. These people were never smokers.
Right.
And now we're seeing a new generation becoming addicted to nicotine. And that is really it's hard to imagine that some of this process is starting all over again, because the nicotine is what keeps them coming back. At the same time, governments are trying to bring in regulations that to limit the number of flavors. We are seeing tobacco companies lobbying very hard against these moves. So there will be consequences. Vaping is harmful. It might be less harmful than smoking, but it does have health harms. We don't know the long-term effects of it. We are seeing significant uptake. Canada has one of the highest teen vaping rates in the world. So there will be consequences and fallout. Could it help some adult smokers? Probably. Are we seeing adult smokers take it up in that way? Not really.
Christine Birak, always fun to talk. Thank you so much.
Thanks for having me.